me begin by giving you a brief background in history. Through the mid-70s, counties were responsible for providing health care to the indigent. In 1976, the state of Minnesota assumed responsibility for the health care cost of low-income and very poor citizens. At about the same time, in exchange for a state block grant given to the counties, the state took over the entire non-federal cost of MA, or medical assistant. Slowly, over the years, the state has shifted back to counties a significant portion of the MA non-federal costs. With the defunding of GAMC, we are seeing an intensification of cost shifting to the counties. In Ramsey County, 47% of our total budget in 2010 will be dedicated to our health and human services efforts. Most is spent on mandates that the federal or state government tells counties that we must provide. In addition, counties provide preventative and alternative services that are not mandated, but they have proven to save money and avoid human suffering. These voluntary programs are often the most progressive and effective services we offer. Studies reveal that over the long term, these types of programs save $4 for every dollar of public money spent. For all of these mandated health and human services, the state provides funding that covers only part of the cost. Since 2003, the gap between mandates and funding has grown ever wider. As the state cut the funding, but not the mandate, we get cuts in terms of aid to the counties, but never a cut in the mandates. And the imbalance on our budgets continues to grow. 1/3 of our property taxes now pays for health and human services. When the state uses more and more county revenues to pay for services delegated to the counties by the state, counties must raise property tax and/or cut other services. In the current economic crisis, pressure on current budgets, county budgets, has increased significantly. Demands for our services goes up, not down, like most entities. For example, counties are seeing record numbers of people applying for food support. While the federal government funds the food support program, county case managers process the applications. In Ramsey County, 12% of our population and nearly 1/4 of our children are receiving food support in Ramsey County. Hennepin County has seen a 30% increase at this time. In Minnesota, to be eligible for food support, the annual income limit for a family of 4 is $28,700. So the group of people in these programs are very vulnerable. They are struggling to provide the most basic needs. All of the individuals who come to the county to access health care are for 2 basic reasons. First, they come because they have special needs and are entitled to specialized care and service. Secondly, people come to the county because they don't have enough income or resources to independently provide for their own basic needs, including health care. If you go to the counties these days, it is taking longer and longer to be seen by a caseworker. It takes longer for several reasons. More people are applying, and the economic downturn is squeezing the county budgets, and we're not able to hire a sufficient number of workers. The application for enrollment in any of the government health care plan is time-consuming. Pulling together all of the required documentation is a daunting task for applicants, and verifying all of it is time-consuming for county and state workers. The healthcare system is complicated, and not by accident. Delay mechanisms have been built into the system to discourage any takers who might be able to retain services on their own. The system is focused more on making sure that someone who doesn't deserve service doesn't get them, then we are ensuring that people that are eligible and in need of services are getting them. To accomplish this, we have created a convoluted, a complicated, counterproductive system that eats time and money. What's left is what we have to pay for services. Some 34,000 GAMC enrollees will lose their current insurance coverage early next year. Though the governor's plan is to automatically enroll them in Minnesota Care program, staying enrolled is something many on GAMC will not be able to do. Under the transfer, counties will be responsible for paying the first 6 months of premiums for all 34,000 GAMC enrollees. That will cost counties $1 to $2 million for 6 months statewide. That's $72,000 to $100,000 in Ramsey County for 3,000 enrollees. Regents Hospital expects to lose over $23 million due to the defunding of GAMC. This is on top of the $42 million in uncompensated care that they provided in 2008. In mental health programming alone, county estimates that outpatient services will add more than $8 million to county costs statewide. In Ramsey County, before the additional costs for former GAMC enrollees are added, we expect to spend $28.3 million overall for adult mental health services in 2010. Chemical health costs, including detox services, are also expected to rise for counties. Without ongoing access to care, the chemical health treatment costs for former GAMC enrollees is likely to increase. Without preventive services, more inpatient and relapse treatment will likely be necessary. Counties cannot raise enough revenue to cover these costs by increasing their levies. Senator Linda Birkeland has made it clear that she does not favor the use of the Health Care Access Fund dollars to cover GAMC enrollees. Of course, the reality is that the fund will be depleted if the GAMC program was simply funded through the Health Care Access Fund. Our options are limited and demands creativity in finding viable solutions. One solution that is not viable is doing nothing. This would push hospitals that provide a disproportionate share of charity care, most notably Regents and Hennepin County Medical Center, to radically trim their services. Doing nothing simply drives unnecessary expensive health care for the uninsured through the doors of hospital emergency rooms, creating the most expensive health care possible. I am hopeful that this forum will intensify the discussion, will spur more people into action, and will help us keep to our convictions as Minnesotans. We have a reputation for quality health care, for building a system that gives us one of the lowest uninsured rates in the country and the lowest per capita cost as well. This is not a time to abandon this tradition, but to work and fight to hold on to it. That if we have everybody in the pool, it eventually makes the system more affordable for everybody. So I think universal coverage is something that's going to happen. The other thing is that we in Minnesota, and there is fear. There's fear all over the country about this, and even fear in Minnesota. But we are, if not one of the best, probably the best model of health care in the whole country. What we got to advocate for is that the rest of the country follows us. We could show the way on how to provide health care for everybody and eventually make it cost-effective and an efficient service. We need to look at a 2-3 year horizon and see how do we start bringing more people into being insured in this state in the long run as we move through the process. That will ensure that it becomes more cost-effective and that we have a better system. Otherwise, it's self-defeating. It's always going to cost more. We're heading in the wrong way. Thank you.